was incredibly difficult for me to just get a hold of my records. And I think the healthcare system today is really just not set up to make it easy, making use of your records as simple as the way that we're used to interacting with all the other technologies in our lives.
Welcome to For the Health of It, our series where we bring together some of the world's top scientists, analysts, and health experts to discuss some of the biggest challenges in healthcare today. I'm your host, Bill Evans. With us today, we have Noga Leviner, CEO and co-founder of PicnicHealth. PicnicHealth is a leading innovator in empowering patients to have control over their own healthcare data by putting it literally in the palm of their hands. Welcome, Noga.
Hi, Bill.
So you founded PicnicHealth after you were diagnosed with Crohn's disease and discovered that your data wasn't being curated or leveraged in a way that would be effective in helping your care. What do you think the root cause of that problem is?
I could point to two things that I've really learned about what the root causes of that problem. One is just that it was incredibly difficult for me to just get a hold of my records. And I think the healthcare system today is really just not set up to make it easy, making use of your records as simple as the way that we're used to interacting with all the other technologies in our lives. And the healthcare system not being set up for that is a big part of why I had the experience that I had. The second thing that I have learned over time is that the healthcare system also really just doesn't have the infrastructure in place for data to be kind of used out of the box. It's structured in so many different ways that there's actually a technology challenge of going from this very messy data at scale to really kind of clean, structured data that then, when it's in patients' hands and with their consent in researchers' hands, can be used effectively for making medical advances. And it's really only with that combination of getting data into patients' hands and making that data the kind of clean, structured, normalized data set that researchers need that it's possible to make these advances.
So how is Picnic helping patients navigate this challenge and take command over their own data?
Giving patients control over their data is really just about giving them access to their data, but actually turning it into something that is useful for them, turning it into something that is not a stack of papers to go through. What we try to do is just take all of patients' medical data and put it into their hands in the same way, they would expect to have it if it was their banking information. Once it's there, they have the opportunity to make the decision themselves how they want it used. And that means both getting it into the hands of their physician, of their provider, of any caregiver that they wish, and also having the opportunity to put their hand up and say that they are comfortable and that they do want to contribute to research as well.
Well, Noga, thank you for joining us today. It was great to hear your perspectives and learn more about the company. To learn more about PicnicHealth, go to picnichealth.com and be sure to follow Komodo on LinkedIn and Twitter for news, updates, and future episodes. This has been For the Health of It. See you next time.